All right, so how do we switch from Warfarin to Xarelto or rivaroxaban? This one is a little bit different. Uh, you can go to Google and type switching from Warfarin to Xarelto or rivaroxaban. You have about more than 400,000 results. Okay, and for the first few ones, there is some uh, information that tell you how to speak to Xarelto from Warfarin. So right here they say from Warfarin, stop Warfarin and start Xarelto when I less than 3. You know that for the aliquots or Badex, when are less than 2, but for Xarelto it's than 3. Why? Why is different? Uh, because Xarelto is kind of little bit, it has a little bit longer half-life. So when it has longer half-life, means the medication lasts longer, and then it take longer time to get to the peak effect. So when the iron is less than 3, so you you stop the warfarin and start Xarelto. It takes some time for Xarelto to work in your body. So that's why they want the iron less than 3 instead of less than. So and then similar to Eliquis, if the patient had the life-threatening blood clot or having high risk of stroke, then you may need to consider the anticoagulant injection, like Lovenox injection. So, I mean, when you want to switch from Xarelto to warfarin, and then you might need to consider the Lovenox injection to make sure um, the patient don't have any uh, stroke risk or any uh, life-threatening blood clot. But when you switch from warfarin to uh, Xarelto, then you only need to know when the iron is less than 3. And, but it's different from the hospital libation and the outpatient patient. So for in the hospital, you may monitor iron or recheck iron maybe daily basis to make sure iron less than 3 before you start the Xarelto. But how about the outpatient setting? You don't do the iron daily basis. How do you plan for that? Uh, for me, when the iron, for example, at the uh, therapeutic iron, then yeah, I just tell the patient to stop the warfarin, and I overnight the Xarelto, or I send the patient to the pharmacy window so they can pick up the Xarelto and start the Xarelto next day, the same schedule they are taking warfarin. So when I know the iron therapeutic, mean it's between 2 and 3, then I'll say go ahead and stop the Warfarin for tonight and start the Xarelto tomorrow. And I know the patient will receive the medication at window, or you have the patient tomorrow via the overnight service. And how about if the iron are too low? If it's too low, then I would just say take half dose of warfarin at their schedule, and then start the Xarelto the next day at the same schedule of warfarin. What happens if the iron are too high? Like 3.5 or uh, 3.5 or 4 or about 3. So if it is about, if the INA about 3.2, then I would just say stop the warfarin for 1 day, and then and, and go ahead and take Xarelto the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Xarelto. If it's 3.6 or above, like 4, and then stop the Xarelto for 2 to 3 days. But if it's more than 4, then I will have to hold the dose and I have the patient to come back, in 1 week and to retest the iron and go from there. But I don't. If it's above 4, and I have to have the patient to recheck the iron. That's how I switch from warfarin to Xarelto.